expose the stapes like this. Next step is to curate the bone near the posterior rim. Can you see this part here? You have to curate this bone to get an adequate exposure, because as you know, stapes surgery is done in a very small area, so try to get as much exposure as possible to make your work simpler. You have to completely visualize the stapes foot plate. So I'm using a curate here and gently curating all the bone in the posterior part of the external canal. So here you need to be careful about the direction of curating also. So all the important structures are around here. So you have to make sure you don't damage the chorda. You have to make sure you don't damage the ossicular chain. So your direction of curating should always be away from the ossicular chain, because while curating you are going to use a lot of force. In case your curate slips and if it goes and hits the ossicles, it will cause subluxation and dislocation of the ossicles, and your whole procedure will be a waste. Okay, because you need an intact ossicular chain while doing the stapedotomy. So what should your limit of curating be? Superiorly, you should curate till you see the horizontal facial canal, which I'm already seeing there, and posteriorly you can curate till you see the pyramidalis process. So if you curate this much of bone, then you have a good exposure and it makes the stapedotomy much easier. Okay, so posteriorly now I am curating till I see the stapedial tendon and the pyramidalis process very clearly. At the same time, you can also curate near the origin of the chorda, so that the chorda stretches and does not come in the way while doing the procedure. So you can see my direction of curating is very important. Always curate away from the direction of the ossicular chain. It got cut, unfortunately. Okay, so now you can see the pyramidalis process. Let me show you under a higher magnification. Okay, so I curated all this bone here. This is the pyramidalis process. You can see the stapedial tendon arising from it. This is the horizontal facial canal. Just tell me if the focus is working. Yeah, when it's not in focus, just let me know. And this is the foot plate here. Okay. And can any of the students tell me what this is? Can you see this bony projection here? Can you tell me what this is? Yes, that's right. So this is the ponticulus. You can see it is going from the pyramid to the promontory. So three pieces: pyramid, promontory and the ponticulus. Okay. So it's very prominent in this, and this area will be the sinus tympani, inferior to the ponticulus. This area will be the sinus tympani. This is the pyramidalis process and this is the ponticulus. So just clearing the plate area here. Some saline, please. Just flush this. not working. It's this plug.